Mr. Wilcox, will now recognize you for 5 minutes.
Good afternoon, Chairman Arrington, Ranking Member O'Rourke, and members of the committee. Thank you for holding this hearing and giving me an opportunity to discuss this issue of the use of official time at the Department of Veterans Affairs. My name is Derk Wilcox. I'm the Senior Attorney at the Mackinac Center for Public Policy. The Mackinac Center is a nonpartisan research and educational institute dedicated to improving the quality of life by promoting sound solutions to public policy questions. I'd like to note that as a practicing attorney, I've had the honor of representing many veterans as their court-appointed counsel in mental health, guardianship, and conservatorship hearings. I've spent many hours at the VA facility in Ann Arbor, Michigan, working with the staff and veterans there. The VA hospitals are beset with many problems as they try to meet the needs of our veterans, and official time is added to those problems. Official time is time spent by federal employees who are paid to perform representational work for their union instead of their regularly assigned work. In the recent past, this body has heard testimony from the Office of Personnel Management, estimated that in 2012, the most recent year for which data is available, employees at the VA used just over 1 million hours on official time. The estimated cost to the VA was just under $47 million. The GAO has criticized the OPM's method of accounting, saying that it undercounts the amount of salaries devoted to official time. Testimony before this committee on February 16, 2017, also criticized the OPM methodology because it failed to account for office space, equipment, phones, travel time, and other factors. But what the GAO did not look at is whether or not the official timekeeping itself is flawed. From my investigations, it appears that use of official time is underreported. I examined cases brought before both the Department of Labor's Employees Compensation Appeals Board and the Federal Labor Relations Authority. These cases involved the use of official time by VA employees, and official time was a central part of these cases. In so doing, I found several cases where more time was devoted to the union's activities than had been reported as official time, as set forth in my written statement. Perhaps the most egregious was a FLRA case out of the Medical Center at Leeds, Massachusetts. A clinical neuropsychologist was also the union president. She was allowed to spend 60% of her work week on official time. However, an arbitrator found that because of her official time, it was an unfair labor practice to require her, as part of her performance appraisal plan, to see any patients per week because, quote, official union duties placed time constraints on the grievance clinical schedule during the work week, unquote. It was unfair to require her to see as few as one patient for testing per week. In short, what was recorded as 60% official time effectively became 100% official time. The enactment of H.R. 1461 could provide the necessary tool to properly count the hours and total cost of official time at the VA. Likewise, it would restrict official time activities so that physicians, like the psychiatrist in the case above at the Leeds facility, are using their skills and expertise on the treatment for which they are trained and hired and not for union activities. Section 741A's requirement that time be accounted for accurately and to a specific degree should eliminate the case of duty time being used for union activities outside of official time, as the aforementioned cases found. Section 7412E and F should correct the flaws pointed out in the February 16th CEI testimony before this body, which pointed out that official time was not accounting for fringe benefits, office space, or other facilities used for official time. Section 742A correctly restricts official time for being used for political activities or activities related to lobbying. In summary, when cases have been looked at in depth, it has been shown that employees have been using more time for union activities than has been allocated to them as official time. H.R. 1461 would appear to be a necessary first step to properly track how much time VA employees spend on official time, account for the true costs, and restrict the improper uses of official time. Following the enactment of H.R. 1461, we should get a more complete picture of the extent of the problem and better enable managers to effectively use the resources available to help our veterans. I'd like to thank this subcommittee for this opportunity and will welcome any questions.